This is my COVID-19 haircut, which I have not had in quite some time, so it is a little crazy. So I do apologize for that, but that's the way it is. Tonight, Wednesday night is my wife and I. It's usually our date night, so we're cutting it a little short to be with you all tonight to answer some questions. So hopefully this will be helpful. In my thinking of things, this is kind of the accumulation of everything that's been going on for the last 2 to 3 months. This past week, I put out some of my thoughts based on the data and where I think we are, just basically to stimulate some hopefully productive discussion that we can have here on social media with our representatives, those who are supposed to represent us, etc. And so people have asked a lot of questions. We've actually put some things out there for questions to be asked, and so I'm going to go through those. And if there's additional questions, you can feel free to post those, and if there's time at the end, we'll go through those as well. So I'm just going to go through the questions, answer them as best as I can, and we'll kind of go from there. You can feel free to make comments as well. We're tracking those. There'll be links related to some of the things I talk about as far as some of the questions y'all have asked. So I'm just going to go through these and read these out. First question is, I've read that there are 2 of the leading vaccine plans for mass production of vaccine while they're in phase 2 trials. Thus, they're reducing the amount of time to market by months. What are my thoughts on the big increase in death rates around the world? So I think there's 2 questions there. The first one, as far as the vaccines themselves being pushed out early, typically you go phase 1, phase 2, phase 3, and then it goes out to live where it's available to people. And phase 4 is post-marketing surveillance, looking for how safe vaccines are after the fact. The one thing that drug companies are doing is trying to push through the phase 2 just because they want things to be ready as quick as possible. One of the downsides of that is if the vaccines are found to be not as useful, there's lots of money they lose. So one of my concerns is I want to see the actual data when these come out to see their safety, efficacy. A lot of the efficacy is going to be based on antibody production, which is not a direct correlate to how effective the vaccine is, but that's usually what we do for the flu vaccine. So I'm just kind of curious what that's going to look like, because it's supposed to take 12 to 18 months for this particular vaccine to get out, then another 4 months for, even if the vaccine was here today, it still would take 4 months to get it in people's arms. So that's, even if they push it as fast as possible, there's still a whole lot thing of actually getting it out there, which still takes time. You figure, flu vaccine's available in August. It's usually November by the time most people have gotten it, right? So I can't imagine this being any faster than that, especially with the fact that our whole healthcare system has mostly been shut down for the last month. What are my thoughts on the big increase in death rates around the world? I'm not quite sure actually where that question's coming from, because if you look at death rates in Europe and the United States, even in Italy, they've been coming down as we've been discovering more and more undiagnosed cases before. Now we think maybe 50% of people in Iceland were asymptomatic. There was one antibody test in Santa Clara, California, showing maybe 3% of the whole population there has had it. And there was a homeless shelter in Boston that had almost half of the people there were asymptomatic. So as you look at this, the actual mortality is going down. So I'm not sure where that question came from. Maybe it's related to third world countries. If you see the virus, it's actually going from the northern part of the world to the southern part of the world. So maybe that's your South African American data, your other African countries' data. I expect that to be kind of high just because those countries do not have well-developed healthcare systems. They can't really social distance appropriately because of the people don't work for the day. They don't eat. I'm assuming that's where that question came from. But in the West, particularly in the United States, we're actually seeing the mortality come down as we get more data. So next question. I'm not sure about the whole herd immunity thing, since viruses are notorious for changing. And we know someone, and do we know someone is immune after having this? Well, this virus, we still don't know a lot about this virus. Coronaviruses are actually tricky. We've tried to do coronavirus vaccines in the past, and they've been notoriously unsuccessful because the viruses change quickly. I think the best example to think about is the influenza virus. There's this thing called antigenic drift and antigenic shift. And what antigenic drift is, it's like a snowdrift. And every year the virus changes just a little bit. So roughly 25% of the people in any given population get the influenza infection every year. Antigenic shift is when the virus changes radically, and that's like your pandemic flu of 1918. So with this COVID-19, it's a brand new novel virus that we've never seen before. There was some initial data that said the virus was not actually mutating that much, and so the expectation was once you had immunity, it would be for the rest of your life. Something new came out literally 2 days ago suggesting that might be off a little bit. I haven't had a chance to review that data, so I'm not going to speak to that because it hasn't been published for me to review quite yet. It's more anecdotal. But the idea of herd immunity is basically it's roadblocks. If you have 70% of the population that already has an infection, like chickenpox or like measles or polio or something else, what happens is that the roadblocks. And so you might have someone who's never had the infection, but what happens is that they become a roadblock. And that's the concept behind herd immunity, is that if enough people, if there's a room of 4 people and it's me and you, and there's 2 people between us that have both had this, then they become a roadblock from you spreading the virus to me. And that critical mass, critical number for herd immunity is about 70%. My hope is that we get enough people with this infection by fall that the second spike we're expecting won't be as high as some people are thinking it might be. If we only have 3% of the population having the infection, it's going to be a pretty big spike. However, if it's really a lot higher, like I expect it to be based on some of the newer data, then I don't think the spike in the fall is going to be as bad as people are quote unquote saying it. So.
Can I add in a question?
Okay, my media director is going to add in a question. On the data profile, what are they using as the adjuvant? Is it going to be a typical aluminum adjuvant vaccine or not? So it also depends on how quickly it's pushed out. Really super fast. I'm going to have some concerns as far as corner cutting with the vaccine itself. So until I actually see how it takes, how stringent some of the testing is, I can't really speak to that. If it's a typical vaccine, then I would think it'd be safe enough. The question for that person depends on what your risk is. If you're a male, if you're obese, if you're over 60, 65, or 80, because the biggest risk factors for this are basically gender. It's a 70-30 male to female or 60-40 male to female split for density. Those are the biggest, and age. Those are the 3 big factors for this. So it depends on what your underlying risk factors are. And that's not really direct answering, but it's kind of hard to answer that when I don't actually know anything about you or the person asking the question. When is it looking like the antibody testing will be available to the average person who thinks they may have been infected in the last few months? Great question. The testing was supposed to be available, I don't know, back in March. And then late March, and then beginning of April, and last week. So the short answer to that question is I have no idea. The long answer is hopefully within the next week or 2, we're looking at actually in our office getting the ability to do that testing. But actually our rep that was supposed to get us that got furloughed. So we have no idea now if the whole thing is going to be going with our office. And we're an office of 10 practitioners. We're a really, really big office. We usually see 200 to 250 patients a day. So I just can't imagine other places getting the testing ability if it's hard for us to get it. But hopefully within the next week or 2, the antibody testing will be available. But you have to remember that it takes about 14 days to start making antibodies. So if you were sick, you want to probably wait at least, a week or 2 after you're getting better. And if you're trying to see if you were infected with it, trying to think back if you were sick or not. For me personally, I'm working as a physician. I've been out there. I remember seeing patients back in December and January with weird symptoms. So I've already actually, I'm going to test myself as soon as it's available because I've had no symptoms. And I'm kind of curious if I'm one of the 50% maybe that have been exposed and create antibodies. So hopefully within a week or 2. But then the question is, how do we get this test out there? That's the next question. Who does it? Who does the testing? People are scared to go to their doctor's offices right now. That's the next question, is where people actually get this testing done, because currently it requires a physician's order. How long does the virus stay in the air in your home before the HEPA filter cleans the air out? So that's probably referred to some of the things I put out there before, but HEPA filter is filtering out microparticles from your air down to 0.1, 0.03 microns, and this viral particle is attached to other air particles at about 3 microns. The answer to that question is depends on how many CFMs or cubic feet per minute that your air filter actually moves in the air. It also depends on the size of the room. So ideally with a HEPA filter, it'd be a freestanding unit that you'd actually have, high speed, that you actually would feel the air moving a little bit. If you have an average HEPA filter, an average sized room, you're probably going to move the volume of the air maybe several times an hour. But you have to remember that the viral particles probably stay suspended in air when they're aerosolized, which is usually by sneezing, for about 3 hours. So if you have a good HEPA filter, you're going to probably remove it way before that.
I think you missed one.
Missed one? Oh yeah, I missed one. Sorry. That's my media director there again, helping me out with that. Are current treatments for COVID effective? And if so, could we end social distancing and just get treated if we have symptoms? That's a great question. Define effective. If you're defining effective as the treatment keeps you from getting intubated, which you have a 50 to 90% chance of dying if you get intubated, then yeah, I mean they're relatively effective. That's what we're kind of talking about with these treatments. We're not talking about how you get sick and you get better quicker. We're talking about serious kind of things that you don't want to have to need azithromycin plus hydroxychloroquine. You don't want to have to use tocilizumab or any of these other things because that means you're pretty sick. They do actually work. We've seen some pretty good results from them. There's a few things published in the last day or two questioning the efficacy of hydroxychloroquine. Having said that, I've personally had pretty good experience with it, and so other practitioners in the area. They're fairly effective. The best thing is prevention. All the social distancing stuff. The next best thing is sleep. Sleep decreases the risk of there's no supplement, there's no treatment that's going to be as good as decreasing your risk for complications 400%, which is basically the difference between 8 hours of sleep at night and 6 hours of sleep at night. So that's super huge. There are some other supplements we've recommended out there. Vitamin C, D, decreasing your risk of complications from an influenza illness 200 to 300%. So there are a lot of other things you can do that are effective for abating some of the symptoms of viral upper respiratory tract infections. But I would not say, particularly if you're a high-risk individual, getting this is 70% of us are eventually going to get this. You don't want to get it if you don't have to get it.
This is where you are.
Okay. Hopefully that answered that question. That's probably more like a back and forth kind of answer. So next question. I listened to Dr. Hartman's video on face masks. There seems to be a whole wide array of options about them. Some doctors are saying that the material in the face masks they're made of is more harmful than actually getting the virus. They also say it's going to pollute our waters with people discarding them. Any thoughts? Yeah, I mean, waste does cause environmental issues. I think styrofoam cups and straws are probably a lot more harmful for our environment than these face masks. A lot of the material they're made out is similar to HEPA filters. So if you have, in my house, I have like MERV 13 filters in our HVAC system. So every time I throw one of those out, I'm throwing out similar type of materials. So I don't really think that argument, I think we need to, that's a different question. I think we have to work on how much we pollute the planet. Absolutely. I think we have to work on our trash. Absolutely. I think that, but the reality is styrofoam cups and straws and HEPA filters for your house are actually just as bad, if not worse. As far as the materials in themselves being bad for you, I mean, I've not read any literature that says a face mask can kill you, that you can drown in your own secretions from your lungs, that you can have encephalitis from them short term, maybe from toxic chemicals over years and years and years. But we're talking about wearing a face mask for a short period of time versus getting a viral infection that might cause a cytokine storm. So I'm going to say that I would, my thoughts are that I personally am wearing the mask to prevent me from getting it. More also as well, just if I was to get exposed and be an asymptomatic spreader, that I don't give it to other people that I see. So those are my thoughts. I've not read any research that validates that. You're going to see a lot of crazy things out there. Yeah, I mean, yeah, I wouldn't eat the material. Yeah, the material, if you consume it's bad for you, sure, it doesn't degrade that well, but you can say the same thing for plastic cups, styrofoam cups, straws, I mean, a whole list of things. So I just wonder if those people don't use straws and styrofoam cups and plastic at all. Those are my thoughts. Anyway, where can we get accurate COVID data daily? I.e., saw an article Monday saying Virginia's numbers are down, et cetera, et cetera. mixed media messages. So as far as accurate daily data, the most accurate data, there's a couple places. The first of all is the John Hopkins GIS site. And we'll be actually putting a link to that either currently right now. Becky is actually in the process of doing that. Okay, already up there for you. On Facebook. It's already up on Facebook. The second site is actually the Worldometer. The third site is the University of Washington. These are the sites I look at. The University of Washington is a site, it's comparable to the Royal College in England, UK, their estimates on projections. And then the last one, Virginia Department of Health has a site you can go to that tells you the daily numbers for Virginia, as well as how many ventilators. So those are like, if you want the data, that's where you go. I actually, this past weekend, talked about interpreting the data and did a video on how you can kind of walk through it. It was a little data heavy, but actually walk through how you can interpret those links. If you want to look at that, there'll be a link for that as well. But ultimately, you have to realize data is, the data is only good as the people putting the data in. So like with the University of Washington data, they're originally predicting 2.4 million deaths, and then 500,000 and 250,000. And now it's down to 60,000 deaths, which is a typical flu season. But that data stops early August. So what about late August? What about September? What about October? So all these models are flawed in multiple ways because they assume the virus magically disappears in early August, which is not the case. The data from John Hopkins, the GIS site, it's a good site, a lot of information. Worldometer is really nice. I like that because you can actually compare countries and look at testing. But all these things, the problem with all these sites is the big elephant in the room is patients who've had this without symptoms. And none of these sites are taking into account how many patients have had this and gotten better who never saw a physician or did not have symptoms, which may be, depending on what article you look at, anywhere from 15 up to 50% of the population. If that's the case, all these mortality numbers, all the denominators on all these stats are 20 times higher, meaning our mortality rates might be 20 to 50 times lower. And you have to realize that when you look at this data, you have to interpret it appropriately, realizing there's a lot of stuff they're not taking into account for. No, we don't know. How do you think schools will open, and will that be what will be the effect of them operating? Schools, that's how do you social distance in high school? How do you get a bunch of third graders to wear masks? I don't know the answer to this. I think it's going to depend on the locality. For me, whether it's Goochland versus Chesterfield County versus New York City might not open back up. We just don't know how the governors and how the localities and how this is going to look. I just don't see, when schools open back up and the kids go back to school, there'll be some kind of spike because these kids are going to spread it. And once that spike happens, do they go back and hang out with their parents and their parents get this, or do the grandparents get it? And so this is going to happen. We have to work through this. But the reality is young kids, if they get this, the data as of this morning, there were 0 cases of kids in the United States dying less than a year old with this. If you're a child, this is very, very, not very, the chance of dying from this is super, super low. It's mainly the older people. And to be honest with you, that's how herd immunity works. You want all the young people to get it, to get over it so that they won't spread it to the older people. But ultimately, that's going to depend on what the schools do and how they want to reopen. But I don't see social distancing and masks working with elementary school kids or social distancing working with high school kids. We were actually, tonight was date night. I mentioned we went out and got takeout and brought it here for date night, and we're down in Richmond getting the food, and literally lots of college kids were walking around without masks, just hanging out, getting food, looked like having a great time. Once schools back open, I can't see them being any less social distanced and less face masked than they are currently. So, and ultimately, I don't know how we get around that. Because we are still American, people still have choices. So, but that's a different conversation. Are there any supplements you would recommend for anxiety outside of working on environmental factors? I know some have found ashwagandha to be helpful. I also had someone ask me about the Genius line of products on Amazon, etc. So there's actually a couple things there. First of all, I don't personally get supplements on Amazon because, one, you don't know really if they're coming from the manufacturer they say they're coming from. There are a lot of knockoffs, and and I said this before this all happened, there are a lot of actually supplements coming from China that are made by alternative manufacturers. You don't have any idea how long the supplement's been in a warehouse. Not as big of a deal in the wintertime, but in the summertime, if it's been in a warehouse for 2 to 3 to 4 months, you might not be getting what you think you're getting. So I tend not to get supplements in general off Amazon for those reasons.
Put your post up about that.
Okay, Becky just put a post up about that for links and that stuff. That's one of the reasons why on the video about that as well. Okay.
About anxiety with COVID.
About anxiety. Yes, it's about anxiety. The depends on your kind of anxiety. The thing about anxiety, what kind of anxiety? If it's racing thoughts, L-theanine tends to work pretty well with that. It's actually a green tea extract, and usually anywhere from 100 milligrams to 500 milligrams 3 times a day. Douglas Labs makes a pretty good theanine. If it's more cortisol stress, like you just feel ramped up on edge, fight or flight, Relora, which is a product combination of magnolia and philodendron, has pretty good data on lowering cortisol levels, and that's 1 to 2 pills 2 to 3 times a day. That's Pure Encapsulations makes a good product of that. If it's more like you just need to you need to kind of chill, relaxation, like you can't, it's not mind racing or chatter, but it's just you're trying to relax a little bit. GABA can be helpful, but that doesn't work for some people. Again, Pure Encapsulations makes a good GABA. And there's a lot of calming herbs. Valerian is a really nice one. Hops. Gaia makes some really good calming herbs. So it really depends on the kind of anxiety you're talking about. I actually did a podcast on this that hopefully we'll be putting out maybe in the next week or so. We actually did it about 2 months ago and just never posted it because COVID-19 took over everything. But there are a lot of resources on my website about that as well. And our supplement store there if you want to get things at a 25% discount. But my wife is going to say something about this.
No, just before you go into the last question, I have another.
Okay.
Are you done with that part?
So
Before you go into
okay.
the last
But that's the thing about anxiety. Usually I'd recommend a lot of other things that aren't available because everything's closed down. But I think as far as just general anxiety, you got to think about cortisol. You have to think about adrenaline, and you have to think about that mind chatter kind of thing when you sleep. And so that's where I think my big ones would be the theanine, Relora. Ashwagandha is a great adaptogenic herb. It's more for cortisol and HPA axis dysregulation. It's not as much going to be like a Zen kind of thing. There's actually a product from Allergy Research Group called 200 milligrams of Zen, and it's theanine, GABA, and I think tryptophan maybe mixed together. And it's a really cool, good product. Some people like that as well. So lots of options. Hopefully we'll be putting that podcast up soon, and just follow us on social media and you'll see when it comes out. And hopefully we talk about a lot of things and resources from the IFM as well in regards to that.
Okay. There's another question about wiping down like every grocery bag or package that comes in the house. Just
So wiping everything down, that's a hard question. The one thing people aren't talking about is you have to get exposed to a certain amount of the virus to get infected. The analogy I always give to people is if someone had a high viral titer for HIV, and I took an 18 gauge needle, which is a pretty big needle, and I stuck it in them, then stuck it in me. My risk for getting HIV from that needle stick is about 1 in 250. So it's not 100%. And so with tuberculosis, you have to get it, which has a very, very high infectious rate. You still have to get exposed to 8 of the bacillus particles to get tuberculosis. So with this thing, it's not as if you get exposed to one virus. And so when you talk about these things like finding the virus on a paper bag, yes, you can go and find virus on a paper bag by PCR. You can find it in the air. But the question is, how much do you actually need to get an infection? There's things that we know that if you touch it, for example, let's say 100 viral particles are on a paper bag. How many of those viral particles do you get on your hand if you touch the paper bag, then touch your face? Not a lot. Cellulose is actually a lot of things will stick to cellulose, which is what these paper bags are ultimately made of, versus metal or glass or plastic, where they're very smooth and basically you can collect all the particles from that. Or if someone sneezes in the air and you're right in front of them, that's how a lot of these things are transmitted. I think there's a certain degree of hysteria on like articles on this you can find this in air ducts and things like that, but most of the infectiousness is going to be that. The reason social distancing is the way this is being clamped down, even though people are going to grocery stores and even though people are doing takeout, the reason we're seeing all these things flat is because the biggest way this is spread is by water droplets from person to person. The whole thing about the fecal oral, the whole thing about GI symptoms. Sure, you can find viral particles in stool, but hopefully most of us wash our hands after we go to the bathroom, or we should wash our hands after we go to the bathroom. And so the risk of spread is still going to be that coughing, sneezing in the air. It touches a smooth object. Even copper, which has antimicrobial activity, this virus can survive for 3 to 6 hours on copper, which is supposed to be, antimicrobial. So, I'm not as worried about the paper bag thing. I mean, yeah, if you leave it outside, the sun's a great UVA radiation, UVB radiation are great antivirals. But you need to make the main thing the main thing. And the main thing is hand washing. The main thing is social distancing. The main thing, you're wearing a mask. I'm surprised how many people I see not wearing a mask. Like, I would not be worried about your paper bags if you're out at the grocery store without a mask on, So I think those are the big ticket items. And I talk about a lot of these in my my COVID-19 survival guide, which is available on the website, which it's on richmondfunctionalmedicine.com. That talks about a lot of these things. It talks about the HEPA filters. It talks about N95 masks and some recommendations for boosting your immune system. So that's a resource that's there for everybody. Oh wow, time flies, right? Oh yeah, last question. How can this COVID experience become the trigger to help people improve their health with an integrative perspective from local to national, creating a new normal long need in our homes, consumer and health sectors? Creating a new need, in our homes, So that's a great question. How can this be a trigger? And that's something I've been thinking about a lot. I've actually been putting ideas together that might actually talk about, my expectation of how this affects education, how this affects relationships, right? Like people realize we actually kind of need people. Like just looking at screens on Zoom all day long doesn't quite cut it, this is something our family has been dealing with for over 10 years. We adopted our kids. 2 of them have cerebral palsy. Our son has asthma. We've been working on diets, nutritional stuff. We already had NAC in our house for my son's breathing, and for my daughter for some of her neurological issues. And so when this popped up, we already had it. The vitamin D. I think it's really interesting how IV vitamin C, quercetin, zinc. These things were hooey. They were verging on witchcraft literally 5 months ago, and now it's mainstream. And I think it's kind of interesting how a lot of these integrative and functional things that people like myself have been doing for years or decades. IV vitamin C, that use goes back to the 1960s and 1970s. So it's actually, I did a presentation on it at the Medical College of Virginia using IV vitamin C to treat Crohn's disease in the 1970s. So some of these things that are new are actually not that new. So I think what's really great about this is bringing there's other options besides government sanctioned, FDA approved healthcare. Like what you do matters. The food you eat matters. The oils, if you have a lot of trans fats, if you have a lot of hydrogenated oils, those actually increase viral replication in your body. Literally, olive oil, I will use olive leaf extracts with some of my patients with chronic mono as an antiviral. Like literally the oils you put in your diet can have antiviral activity. So I think this has made integrative and functional medicine and these concepts more legit. Like literally when you have, the president talking about hydroxychloroquine as an antiviral, which we've been using in integrative functional, even rheumatologists have been using it for autoimmune diseases or chronic Lyme or other kind of things for a while. This is not a new thing. That it's now catapulting this and making it mainstream. So I hope we can continue this conversation to focus on diet and lifestyle and nutrient supports like vitamin C or flavonoids or green tea extract. I mean, these are things that people have been using for literally decades. They're not new, but they're new to, I guess, the American consciousness. So this has got to be, it's got to be a groundswell. It's got to be people like you all want to know more about. It's got to be people sharing information like this to realize, maybe, vitamin D is so. I was reading something today about, if vitamin D actually might decrease the risk of viral replication. And it's like, that's such old information. Like a low D is associated with increased risk for prostate cancer, breast cancer, colon cancer, diabetes, dementia, increased risk for viral infections. I mean, it's like the whole inflammasome thing with the cytokine storm. Literally, vitamin D helps modulate that inflammatory response. So my hope is that this the conversation doesn't stop here. It keeps on going after this once we work through summertime. And that's going to be up to you all. Just staying active, staying involved, educating yourself, your friends. That's one of the reasons why I've set our website up the way I've set it up, is so that people can go there and find resources. I've been doing a book reading list there. There's food sources there for food guides. I just started the podcast, which is not podcast, the podcast. Yeah, podcast. Yeah, I'm not the tech person. Sorry, the podcast. Like to educate people. So hopefully those will be resources that you can use, share with your friends and family. But ultimately, people have to value this. They have to value, cooking food at home. Like, this was not a big change for us because most of our meals are cooked in the home. We already had sourced our meats from local places. One of my things I think I'm going to see is a change from our food being sourced 1,500 to 2,000 miles away from us. The average food you get in a grocery store, did you know, travels 1,500 miles before it gets to that shelf in the grocery store. Why do you need beef from Texas? Love Texas, no offense, but when you can literally buy it from Brookview Farm, that's about. If you're in Virginia, if you're in Virginia, if you're in Texas, if you're in Texas, if you're in Texas, listening to this, get your beef from Texas, absolutely. But the idea is that sourcing things locally. We're learning in the hard way that, if you're getting your food locally, if you're getting a lot of your manufacturing locally, your produce locally, this is not disrupting your life that much. If you're depending on your milk to come from the Midwest and your greens to come from California, then you're dependent on literally hundreds of people getting it to you. And that's where I think one of the effects that we're going to see this is the localization of our food sourcing. We're going to see a lot of educational changes, and I'm hopefully going to talk about this a little more. I'm still thinking about the concepts and reading on it, but ultimately this is up to y'all to learn and grow and continue to want to be the best you can be, to be healthy, because this is not going away. This will come back in the fall, ultimately, unless we get a vaccine, which if we get, it's going to be probably a year. 70% of us are going to have to get this. And so we need to do this in a fashion that doesn't overwhelm our healthcare system, that keeps the healthy and keeps the vulnerable safe. And that's kind of what our resources like this are hopefully helping you to do that. I want to remind people about the survival guide on the website, the resources there. If you feel like this is helpful, please follow us, please like us. Follow us on Facebook, Instagram, or
Back to the survival guide.
YouTube.
That is information that's applicable to every virus.
Oh yeah. So
it'll be useful in the fall. It'll be useful.
Yeah, the survival guide, it's really kind of interesting because it was basically me compiling data I already had on a bunch of other things. But a lot of the stuff there, is not specific for COVID-19. It's for viral respiratory tract infections with nuances for COVID-19. So every flu season, guess what? D is great for every flu season. C is great for every flu season. So is zinc. Quercetin. It was kind of funny. I was talking with my father-in-law about some of these things, and he's like, "Oh wow, look, quercetin, how amazing these things are." He had no idea that literally the quercetin is great for your liver. He's got some health issues that it actually can help with. EGCG as well is great for kidney issues that he's got some issues with. It's really interesting how these things are natural substances are multimodal. Cranberry is great for UTIs. It's also great for Alzheimer's prevention. It's also great as an anti-inflammatory. And the flavonoids in cranberry also, there's, I think, an article I put in the survival guide talks about using it for actually as an antiviral. Food is multimodal. Food is medicine. That's a starting place. And that survival guide is a resource for you there. So hopefully this was helpful. Please keep on asking questions. If this is helpful, let us know. Give us some feedback. We can keep on doing these as needed. My goal is to keep on putting stuff out there when things change. I'm not trying to chase my tail as far as just doing this to do it, because there's already enough people out there. You don't need someone else to preoccupy your time. But as things change, I'm going to continue to put stuff that I feel is helpful out there. And that's our time. So
okay, just a quick thing. Somebody asked where this will be posted. It will be in our Instagram story there's the normal story, and then there's a section called live. It will be there for 24 hours. After that, you can find it on YouTube. I think our YouTube channel is just Aaron Hartman, MD. And Facebook, they'll stay there pretty much in perpetuity. Facebook doesn't always show people things, but YouTube you can usually find it. We don't have enough videos on there that it's difficult to find anything. So if you want to find it later, that's probably the best.
YouTube is probably the best because Facebook just stuff disappears randomly, and Instagram stuff just
Instagram, it definitely will be gone.
Yeah,
24 hours from now.
Yeah.
So.
All right. Any other systemic? That's it. Okay, cool. All right. Well, you all have a great night. Take care.